And we know that when there's opportunities for nurses, for registered nurses to get an advanced degree and get a master's degree and become a nurse practitioner, that it actually increases the number of providers in the area. So there really is a limitless need. We've got people moving into Texas. The number of people in Texas are increasing boundlessly every day. They say like a small state are moving here all the time. And so there's an unlimited need really for care because of the aging population too. Well, one of the main challenges we really have in this area is preceptors, because we use a preceptor model, and having enough physicians, physician's assistants, and nurse practitioners to work side by side and work with our nurse practitioner students. That's a problem. But as far as transitioning to the nurse practitioner role, it just takes time, and it's a process. And we do a pretty good job of it. We have at Texas A&M Corpus Christi, we have a 97% pass rate on our boards for this summer. Not everybody's tested, but it's going pretty well. You can call the College of Nursing and Health Sciences at Texas A&M Corpus Christi and just tell them you're interested in being a preceptor. And also we have a professional organization of nurse practitioners here called Coastal Bend Advanced Practice Nurses. And in our website, it's coastalbendapn.org. We have a little link there that says, I want to be a preceptor. And so that's another way to help us out. We have a Texas state organization called Texas Nurse Practitioners, and it's texasnp.org, and it provides lots of information about nurse practitioners in the state of Texas.
A primary healthcare nurse practitioner works in the community in places like doctor's offices, community health centers, clinics. We are nurses, first and foremost. We also have authority to do a variety of functions that were traditionally associated with doctors, such as ordering a variety of medications, laboratory tests, x-rays, and following up with people over time.
Well, hi, you're Tony.
Yes, I am.
And I'm Falco. I'm a nurse practitioner here at the clinic, and this is the first time I'm meeting you, I guess.
Yep.
Right, come on in. A lot of what we do as nurse practitioners is health promotion and illness prevention, and dealing with episodic illnesses and management or co-management of chronic illnesses. And what is it that bothers you? Oh, throat and ear. Nurse practitioners have a lot of autonomy. The scope of practice that they're working in is quite immense. Did you take any medicine this morning? My work is the connection to the clients. I personally can say that I really enjoy being a nurse practitioner and enjoy these personal stories. Really wide, stretch your tongue out, and a nice big ah. Wow, that's very good, thank you.
Ontario nurse practitioners play an integral part in the healthcare system, providing a full range of services, helping people in the community maintain healthy lifestyles. Nurse practitioners also influence policies on healthcare to keep your family and community in good health.
In the 90s, there was a real movement across Canada for primary healthcare reform, and in Ontario, one of the ways that was looked at was bringing in the primary healthcare nurse practitioner role. And in 1998, the legislation was passed that approved nurse practitioners, and since that time, the scope of practice has continued to expand and the role to be better integrated throughout the healthcare system. I wanted to be a nurse practitioner because I really enjoy that increased responsibility and the autonomy and responsibility for making decisions about care in a broader scope. In hospitals, nurses work under very specific policies and procedures, and nurse practitioners in a community setting in primary health care have more freedom around selecting how things would work best for a particular person.
For more information about nurse practitioners, visit the Ontario Primary Healthcare Nurse Practitioner website.
So I went back to the doctors because when I needed a second opinion, and I went back and told him he was a good doctor, but he wasn't there. I got some woman in a white coat standing there. I said, "Excuse me, but who are you?" She said, "I'm a nurse practitioner." I said, "You mean you're practicing being a nurse?" She said, no, not quite like that. "No, I am a qualified nurse." I said, "Oh, then why do they call you a practitioner? Because you're practicing on me. I'm not sure I want that." She said, no. Nurse practitioners allowed to give you prescriptions, help you with minor surgeries, and all that kind of thing. And I take care of you when the doc's not around. She said, "We're going to become really popular." I said, "Well, blimey, somebody like you is going to be really popular, let me tell you." Oh, she said she got offended with that. So I said, "Sorry, I didn't mean to offend you. But now I know what a nurse practitioner is, don't I?" Remember that, nurse practitioner, they're the future. Find a good one.
That's really where the focus is going to go, especially with again, all of the changes in healthcare. We need to focus more on prevention than disease management. To be, of course, be more cost effective, it just makes more sense. I feel that nurse practitioners can again fill in, especially when it comes to the underserved and underprivileged population. We can sort of be, again, physician extenders and go out to them and meet their needs. Hopefully preventing unnecessary hospitalizations. That's really the goal, because we all know that the cost of health care in this country is just outrageous. It's out of control, and something needs to be done.
Well, we're seeing a lot more people with diabetes and hypertension, and not only 30-year-olds, but I have a lot of high school kids. You see them already starting with their blood pressure going up, so you need this preventative care. If not, those kids are going to be our future diabetics, hypertensives, obese people of the society.
Well, a nurse practitioner will provide health care within her scope. If someone has a simple infection, managing diabetes, hypertension, all of those things are within their scope. If it's something that's more complicated, we'll refer to a specialist, and we'll consult with our physicians and other specialists to make sure that our patients get the right kind of care. We're concerned about our patients. We want to treat them and take care of them. We want them to have good outcomes. That's very important. We're going to look into our resources and make sure that we're taking care of the patients that have those specific needs the right way.
Well, in the interest of not getting into a political debate and really giving my true opinion, one thing is for sure, healthcare in this country is a mess. And regardless of what side of the political fence you're on, I think we all agree that something needs to be done. The cost of healthcare in this country is out of control, and that's why we're in the mess we're in. Again, it's been proven in studies that nurse practitioners can help alleviate some of those costs and work alongside with physicians, not in competition, but in collaboration, taking care of the people of our communities. There's a huge physician shortage. Texas presently has one of the worst physician shortages ever, and we can help fill that void.
I want to thank everybody for tuning in and watching our documentary and learning more about what nurse practitioners do in Texas and around the United States. As in Texas, many states have a collaboration agreement between a physician and a nurse practitioner, but there are also other states that are allowing nurse practitioners to practice independently. Nurse practitioners are providing a method of care that takes care of over 90% of acute and chronic illnesses that society faces. Our population is aging. Nurse practitioners are also there to help not only the elderly, but also children and the whole family. Nurse practitioners can help you to get more involved. Contact the numbers at the bottom of your screen and visit the website. Learn more about nurse practitioners and their role, and visit a nurse practitioner today. In collaboration with physicians right here in Texas, we can take care of many of the health problems that you face. Thank you, and God bless.